Good morning and welcome to the Senate Committee on Commerce and Labor. Madam Secretary, please take the roll.
Senator Daley. Here. Senator Ellison. Present. Senator Flores. Senator Lang. Here. Senator Rogish. Here. Senator Scheibel. Here. Senator Steinbeck. Here. Chair Pezzina.
Present. Thank you so much, and please mark Senator Flores present when he arrives. We do have a quorum, and we'd like to welcome our members here, as well as our audience here in Carson City, as well as those joining us in Las Vegas and those following along online. Before we begin, we do have just a few housekeeping reminders. We'd like to ask everyone to please silence all of your electronic devices while in the committee room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in the place of. If you wish to testify in person, please sign in at the table by the door and leave your business card with the committee secretary. When testifying in person, please turn the microphones on to speak and off to listen, because we have others listening and viewing our meeting in Las Vegas as well as following along online. Anyone who'd like to receive electronic notifications of scheduled bills and access to the committee's materials may do so by signing up on Nellis on the legislative website. And committee members, please note we'll be using our laptops to view handouts and exhibits, so please do not view this as a sign of disrespect or inattention. Also, I forgot to mention earlier, when you are coming up to the microphone, please do state and spell your name for the record. All right, with that, we are going to start today with a work session, and then after that work session, we are going to move into our bills on the agenda in order. So we will be taking the bills in order today, starting with AB 207. But first, members, we do have a work session. And with that, let's begin. I'm going to hand it over to Mr. Ashton, who will summarize the measures on today's consent calendar.
Thank you, Chair Pezzina. For the record, Patrick Ashton, Research Division, LCB. As nonpartisan staff, I can neither support nor advocate and oppose any measures before you today. And members, similar to Monday, you should have received by email and also have on your desk a copy of the combined work session document. This document contains one consent calendar for bills without any proposed amendments on page 3. Additionally, the combined work session document has 3 bills that will be considered separately during the work session today. The bills on the consent calendars do not have further discussion or debate. Any member may request that the item be removed from the consent calendar for further discussion and a separate vote. The following measures are on the consent calendar. AB 38, which revises various provisions relating to housing. AB 56, which revises provisions relating to the licensing of certain providers of health care. AB 177, which makes various changes relating to audiology, fitting and dispensing hearing aids, and speech pathology. AB 202, which revises provisions relating to claims for dental care. AB 430, which exempts persons engaged in the provision of payroll processing services from provisions governing money transmission. And AB 512, which revises provisions relating to casualty insurance. And members, you can find more detailed summaries for these bills on pages 4 through 9 of the combined work session document. Thank you, Chair Pezzina.
Thank you so much, Mr. Ashton. Members, does anyone want to pull a bill from the consent calendar for further discussion? Okay. Not seeing anyone, I'll now entertain a motion to do pass for the bills on the consent calendar as summarized by Mr. Ashton.
Motion to do pass the bills on the consent calendar as just mentioned.
Okay, wonderful. I have a do pass motion for Assembly Bills 38, 56, 177, 202, 430, and 512 from Vice Chair Daley. Do I have a second? A second from Senator Steinbeck, and your timing is impeccable because I will now say any further discussion. All in favor, please say aye. Aye. Any opposed, say nay. Thank you so much. The motion carries. And with that, we will move to the next item on our agenda, which is, I need to assign floor statements. For AB 38, we will go with Senator Steinbeck. For AB 56, we will go with Senator Scheibel. For AB 177, Senator Lang. I will take Assembly Bill 202. Assembly Bill 430 will be assigned to Senator Daley. And AB 512 will be assigned to Senator Flores. You may have noticed that we're working our way down the aisle, so more to come. And with that, we will move to the next item on our work session calendar today, which is Assembly Bill 12, and I will hand it over to Mr. Ashton.
Thank you, Chairperson. For the record, Patrick Ashton, Research Division, LCB. The next item is Assembly Bill 12, which was heard on April 21st. And for the sake of time, I will go straight to the amendments. Senator Daley and Mr. Jordan, Deputy Director of DEDR, proposed the attached conceptual amendment to Section 1, which is attached to the work session document of the bill, And in summary, the amendment provides in subsection 3 that the respondents may object to a service of the petition it deems insufficient and authorizes petitioners to cure any alleged deficiencies within 10 business days, among other provisions, with strict compliance required. A court must dismiss the action for lack of jurisdiction if such deficiencies are not cured within 10 business days upon the respondent's motion, and the amendment requires in subsection 4 conforming changes for such pleadings and also requires the administrator, if the case is not dismissed after filing an objection to the service of the petition, to file an answer and all required documents within 45 days of resolving any pleadings under subsection 3. Thank you, Chair.
Thank you so much. Do we have any questions? Seeing no questions, I'll entertain a motion to amend, do pass Assembly Bill 12.
Motion to amend and do pass Assembly Bill 12.
Thank you so much from our Vice Chair. Do we have a second? A second from Senator Scheibel. Do we have any further questions? Okay. All in favor, please say aye. Aye. Any opposed, say nay. All right, the motion carries, and I will assign the floor statement for AB 12 to Senator Rogish. And with that, let's move on to Assembly Bill 250. Thank you so much, Mr. Ashton.
Thank you, Chair. For the record, Patrick Ashton, Research Division, LCB. AB 250 was heard on May 12th, and I go straight to the amendments again. Assemblymember Golding proposes the attached conceptual amendment to the work session document. In summary, the amendment makes changes to Section 1 by revising subsection 1 that the civil action must be about the collection of an unsecured debt, which is not a credit instrument evidencing a gaming debt. It removes subsection 2 and revises in subsection 3 the definition of coerced debt. There are also new provisions added by this conceptual amendment to require the debtor to provide an attested statement with disclosures to assert coerced debt as an affirmative defense that includes provisions as outlined in items 4A through E on the bill page, and directs the court upon finding a preponderance of evidence that the debt is coerced to complete certain actions as outlined in items 5A through C of the bill page, and also add Senators Krasner and Steinbeck as co-sponsors of the bill. Thank you, Chair.
Thank you so much, Mr. Ashton. Do we have any questions on Assembly Bill 250? Okay. Senator Ellison.
Thank you, Madam Chair. I'm going to be voting no, but I want to reserve my rights. I want to get with the sponsor.
Okay.
Thank you.
Thank you so much. Senator Scheibel?
I actually do have a question. I don't see the sponsor here, but I don't know if anybody can speak to the amendment and whether this is intended to make the protections more or less expansive for survivors of trafficking and domestic violence. It looks more prescriptive to me, but I'm wondering if I'm reading it wrong.
Mr. Norman, welcome.
Chair, members of the committee, so this was the amendment that was presented at the hearing, and it is more prescriptive. That was in negotiations with industry to get them to neutral or a place of support.
Okay, I apologize. I thought this was different from the amendment that was presented. I don't know why. It's been a long day. At 8:11.
All right, that's
Thank
going to
you.
be my favorite thing for the day. Is that statement?
Thank you. And Madam Secretary, that was Jonathan Norman for the record. Thank you so much. Okay. Do we have any further questions on Assembly Bill 250? Okay. Not seeing anyone, I will take a motion to amend, do pass Assembly Bill 250.
Motion to amend and do pass Assembly Bill 250.
Thank you so much. A motion from our Vice Chair. Do we have a second? Second. A second from Senator Scheibel. Any further discussion? Not seeing any. All in favor, please say aye. Aye. Any opposed, say nay. Please note that we do have a nay from Senator Ellison, who has reserved his right. And with that, the motion carries, and I will assign the Assembly Bill 250 floor statement to Senator Steinbeck. And with that, Mr. Ashton, we are on to our last item on the work session agenda, which is AB 511.
For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 511 was heard on April 25th, and I will go straight to the amendments again. Dr. Yeager, in coordination with Mr. Blaine from the Division of Insurance, proposes the amendments attached also to the bill page, which revises sections 1 through 32 to retain deleted provisions that entitle an insured to reimbursement for treatment, thus providing that either the insured or the provider, as applicable, is entitled to the reimbursement, and adds provisions that provide for assignments of benefits to chapters 695B and 695C of NRS. Thank you, Chair.
Thank you so much, Mr. Ashton. Do we have any questions on Assembly Bill 511? I know when we had the hearing, Mr. Plain came in and there were some really productive discussions. He's here in the room right now, and he worked with Dr. Yeager on that amendment. Any questions? Yep.
Mr. Blaine for the, just want to make sure that we got the assignment of benefits, and so everything kind of works the same way it is now. People understand that. So the insurance have the right to collect, which is what we were trying to get to, but only if there's an assignment of benefits or some measure that's been taken, so they have that right.
For the record, Adam Plain, Division of Insurance, Senator Daly. Yes, that's the intent with the amended language, that it retains the existing ability for the insured to be paid directly, adds the new proposed language for the the provider to be paid directly, and copies existing assignment of benefits language from other chapters to chapters where it does not currently exist.
Excellent, thank you.
Okay, thank you so much. With that, do we have any further questions on Assembly Bill 511? Okay, not seeing any, I will accept a motion to amend to pass AB 511.
Motion to amend and do pass AB 511.
A motion to amend do pass from our vice chair. Do we have a second? A second from Senator Scheibel. Is there any further discussion? Okay, not seeing any. All in favor, please say aye. Aye. Any opposed, say nay. And AB 511 passes unanimously. And Senator Ellison, you have a floor statement, and it will be AB 511. And with that, we are finished with our work session this morning, and we will move to our very first item on the agenda for bill hearings, which is AB 207, which revises provisions governing the submission of certain information to the Commissioner of Insurance relating to mental health parity and addiction equity. And we welcome Assemblymember Cole and her co-presenters.
Thank you so much. Good to be here on this very long Wednesday morning. So good morning, Chair Pazina, Vice Chair Daly, and members of the committee. My name is Lisa Cole. That's Lisacole. I am honored to be accompanied today by Spencer Flanders and Dr. Lori Drucker to help me present this bill. And for the record, I am also the Assembly member for AD4 in Las Vegas. So mental health impacts every family, every community, and every corner of our state. It doesn't discriminate by age, income, or political affiliation. It affects hardworking Nevadans who simply want to live productive, fulfilling lives. Yet many of these people are being denied the care that they are rightfully entitled to under the law. This bill isn't about expanding government or increasing spending. It's about ensuring fairness and accountability in a system that is already in place. We have laws on the books that guarantee mental health parity, but without transparency, those laws are meaningless. We know that when a person reaches out to a mental health practitioner, they need help, often very immediate help. And any barrier to receiving that help can be devastating to that person and to their families, friends, and coworkers. Hardworking Nevadans are covered by health insurance should receive the care they need, and if a claim is denied, it's imperative that we understand why. This bill is about transparency, it's about making sure our systems work as they are intended, and it's about giving Nevadans the tools they need to make informed decisions for themselves and their families. I sit here today actually, not asking for more regulation, but for fairness, clarity, and accountability, because every Nevadan deserves to know that when they need help, that help and the safety net that they paid for will be there for them. Chair Bozzino, with your permission, I would like to pass off the presentation to Spencer Flanders now, who will give us details and background on the bill. Thank you.
Good morning, Chair Bozzino and members of the committee. For the record, my name is Spencer Flanders, S-P-E-N-C-E-R, F-L-A-N-D-E-R-S. I am with Tri-Strategies, and today I'm excited to be representing the Nevada Psychological Association as we discuss Assembly Bill 207, which deals directly with mental health parity. Now, some of you may be asking, what is mental health parity? In the most simple terms, it's when we treat mental health care the same as physical health care. And this isn't just me saying this is actually codified inside of law, the federal law that is, in the Paul Wellstone and Pete Domicile Mental Health Parity and Addiction Equality Act of 2008. And if I quote the act itself, it says, the treatment limitation applicable to such mental health or substance use disorders benefits can be no more restrictive than the predominant treatment limitation applied to substantially all medical and surgical benefits insured by the plan. And what this does is ensure equal coverage for mental health and creates parity. Now, this act has a couple mechanisms to it, especially dealing with transparency. For one, it has disclosure of medical necessary criteria. When you get your EOB, when you get your insurance, your explanation of benefits, it's going to say you have this amount of appointments for this amount of appointments for that. So say you had 10 appointments for physical therapy. Well, on that explanation of benefits, it also needs to have 10 mental health appointments because that is parity. The second part of the transparency is the explanation of the denial claims, which they need to submit to both state governments and the federal government. What's interesting about this act is that it actually gives states the authority to regulate mental health parity, which is extremely important. So, how does the federal government go ahead and collect their information for mental health parity? Well, they use the system of electronic rate and form filing, called CERF. This is developed by the National Association of Insurance Commissioners and requires the federal government to collect this information. What does the CERF actually collect? Well, it collects denial justifications, detailed reasons for denying claims, including references and policy provisions. It has medical necessary criteria, disclosure of the criteria. We have appeal information, we have regulatory compliances, and it aggregates everything into statistical data points so we can actually see what's going on. The federal government uses this, but there's also many different states across the nation that use this, such as California, Oregon, New York, Washington, Massachusetts, Tennessee, Ohio, and Arizona. They all use the CERF to collect their mental health parity information. What are we doing inside of the state of Nevada? Well, we're not currently using the CERF. Right now, the insurance commissioner collects information through various system forms, which makes it kind of disorganized and not able to see the information quickly. And this can make it extremely difficult. So we're here with Assembly Bill 207 today because we don't want to, we're here for 207 today because we're not, I'm trying to make a joke, but it's not going to work.
It's been a long
too
morning,
early.
huh?
It worked during the first hearing. Anyways, we're here today because when the Nevada Psychological Association approached the insurance commissioner about some denial claims, we were denied access to that. And we want to make sure that we have the transparency for that, which is extremely important. To talk more about this, we have Dr. Lori Drucker, who's a psychologist in Northern Nevada. She has to deal with mental health constantly every day and deals with insurances. So I think it's important to hear her point of view. So I'm going to go ahead and pass the microphone off to her.
My name is Dr. Lori Drucker, L-A-U-R-I-E-D-R-U-C-K-E-R. I am a psychologist in Reno. Thank you, Senator Pezzina and members of the committee for this opportunity to speak with you. I see some familiar faces, and I appreciate all the work that you're doing. So I've been a provider in the state long enough to see the benefits that MPIA, the Mental Health Parity Act, has brought to the patients that I work with. Mental health care should be considered a primary health care intervention, especially given the numbers of people in our state who need mental health services. MAPIA was an effort to try to bring mental health services into compliance with the coverage that's afforded to people for medical surgical benefits under their insurance plans. In my personal experience, patients went from requiring authorization for ongoing treatment after 10 sessions to being able to have access to their primary care mental health services without prior authorization. Co-payments went from co-insurance rates down to co-pays the same as one would pay for a primary care provider, which was wonderful because it improved access, it reduced stigma, and it allowed more people to receive mental health services. Over the years, that's been whittled away and continues to require additional legislation to support the continuation of those benefits. Nevada's been great. Over the years, this legislature has adopted compliance with mental health parity standards, and in 2021, required insurers to report to the Division of Insurance how they are administering what are called non-quantitative treatment limitations, which are the ways that they decide which claims they pay, which claims they deny, who's on the panel, and how they do reimbursement rates. Unfortunately, and then one of the reasons why we're here, is that in those reports that the Division of Insurance has been receiving, they are showing that there is substantial inequities between medical surgical benefits and mental health benefits. These are showing up in terms of claim denials and utilization review reports. So for instance, if you are a person with insurance and you go to your provider panel and you don't have a provider accessible to you, you want to use your out-of-network benefits, it costs you substantially more to use those out-of-network benefits than if you were seeking medical care, couldn't find an in-network provider, and had to use out-of-network services. So that's one area in which the inequities are already being reported. Another area has to do with reimbursement rates for providers. So providers on the on the mental health and substance abuse side of things are paid substantially less, sometimes as much as 34 or 40% less than medical providers for the same quality of care and office visit. Again, we are in this bill requesting more transparency about how that data is reported so the Division of Insurance can do their job to require commercial insurers in the state to correct any errors in how they are paying for mental health services and improve and maintain the access to care in our state. I like to think of it as like a leaky ship in our state. We have a lot of systemic and structural barriers. I know you are all familiar with those and have heard lots and lots of testimony in this session on provider workforce shortages, which are across the state. Mental health needs are huge. We're at the bottom of the nation in stats we don't want to be at the bottom of the nation in. And so I think of this as a very small way to plug a hole. Doesn't require the state to spend any extra money, and will allow us to continue to build a stronger foundation for mental health care delivery systems. Thank you very much for listening to our testimony, and we urge you to support this bill.
Chair, with permission, I'd like to do a walkthrough of the bill. Spencer Flanders, for the record. Just keep it nice and simple. Subsection 3, insurance must submit their mental health parity information to the SERF. We look at subsection 4, mental health parity data submitted to the commissioner is now public unless personal consumer ID information's on there or trade secrets. Subsection 4B, the commission can't claim the data is trade secret just because it's as long as it's non-compliant. And then we're striking subsection 5 due to the Division of Insurance saying it's repetitive. And with that, Chair, I believe we're open for questions. Thank you.
Okay, thank you so much for the presentation. Do we have any questions this morning? It's been a long day. I don't see any. So with that, we'll have you step back from the table. Thank you so much. And we will open this up for testimony in support of Assembly Bill 207. And we'll start in our physical locations, and then we'll move to the phone lines.
Good morning, Madam Chair, members of the committee. Alex Tanchek with Silver State Government Relations, representing the Nevada Advanced Practice Nurses Association. A large segment of Nevada's APRNs have advanced training in therapeutic and psychiatric care, and ensuring transparency and mental health parity is important to the health of all Nevadans. Thank you.
Thank you so much. Not seeing anyone else in our physical locations, we are going to move to the phone lines broadcast. Do we have anyone on the phones who'd like to testify in support of Assembly Bill 207?
If you would like to testify in support of AB 207, please press star 9 now. Chair, you have no callers in support at this time.
Thank you so much. With that, we will open it up for testimony in opposition of Assembly Bill 207. Starting in our physical locations and seeing no one coming forward, we are back to you broadcast. Anyone on the phone lines who'd like to testify in opposition of Assembly Bill 207?
If you would like to testify in opposition of AB 207, please press star 9 now to take your place in the queue. Chair, you have no callers in opposition at this time.
All right, and that moves us to neutral, and it wouldn't be a day if there wasn't an Adam Plain sighting, so welcome.
Thank you, Chair Pizzina, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. I did submit written testimony to Nellis. Hopefully it's there. It has a little bit more detailed analysis. I wanted to touch on a couple quick points. One, just to note for the record that SIRF, the System for Electronic Rate and Form Filings, is not a division-owned system. It's owned by the National Association of Insurance Commissioners. We've reached out to some of our cohorts in other states. There may be a couple issues with file size, things that other people have encountered. We will, of course, use SIRF as directed, but there may be instances, for example, where an insurer submits a cover page to SIRF, letting us know that data has been submitted in another fashion to create the proper information trail. Additionally, as noted in the presentation, we did request that Section 1, Subsection 5 be deleted. I would appreciate Assemblymember Cole, I don't know what's the word I want to use. Acquiescing is not the correct word, but supporting, yes. It's been a long day. Supporting our request. It is partially duplicative of some existing statutes, and we're concerned that its inclusion could give the impression that the work papers associated with the Division of Insurance's analysis of trade secrets might not be protected because they are not themselves trade secrets. So we wanted to make sure that our internal analysis was not affected. Yeah, if there's any questions, I'd be happy to answer them.
All right, I don't see any questions, but we thank you so much for being here always. And seeing no one else coming up in neutral, we are going to move to the phone lines broadcast. Is there anyone on the phone lines who'd like to testify in neutral on Assembly Bill 207?
If you would like to testify neutral on AB 207, please press star 9 now to take your place in the queue. Chair, you have no callers neutral at this time.
All right. With that, would you like to make any closing statements? Okay. Well, thank you so much. We thank you for being here today, and we will close the hearing on Assembly Bill 207, and we will move into the hearing on Assembly Bill 248, which ratifies the Physical Therapy Licensure Compact. And we will welcome Assembly Member and Chair from the Assembly, Marzola, and her co-presenter.
Good morning, and thank you, Chair Pizzina and members of the committee. For the record, I'm Relay Marzola, and I represent Assembly District 21. I'm the sponsor of Assembly Bill 248, which ratifies the Physical Therapy Licensure Compact. With me today here in Carson City, I have Paul Klein with Tri-Strategies, and on Zoom, we should have Jeffrey Rosa Hopefully he's on Zoom. There we go. He is the managing director of the post-licensure services at the Federation of the State Boards of Physical Therapy. Jeff and Paul will be going over the licensure compact. I also have on Zoom Kelly Mae Douglas, who is the Pacific Southwest Regional Liaison with the Department of Defense. She assists states in enacting policy to benefit military members and their family. With your permission, Chair, I will go over some background information and then hand it over to my co-presenters. Like most professions in healthcare, Nevada faces a critical shortage of quality providers and access to physical therapists. The need is particularly dire for the retired and underserved residents in the state, especially those in the rural and frontier areas. Physical therapists, also known as PTs, and physical therapist assistants help Nevadans reduce pain and gain strength, flexibility, and balance, which optimizes their function and quality of life. By enacting the Physical Therapy Licensure Compact, AB 248 will bring high-quality PTs and PTAs to Nevada, which will assist patients and healthcare providers and improve access to quality healthcare. The Interstate Compact also allows a person who is licensed as a PT or PTA in that state that is a member of the compact to provide in-person services in other states that are members of that same compact. Before providing such services, the compact requires a PT or PTA to meet certain requirements, including maintaining a license in good standing in that person's home state. The bill further clarifies that a PT or PTA who is authorized to practice in the state pursuant to the compact is authorized to engage in the same activities as a PT or PTA who is licensed in Nevada. With your permission, Chair, I would like to hand the presentation over to Jeff Rosa. Thank you.
For the record, my name is Jeff Rosa, Jeffrosa, and I'm the Compact Administrator with the Physical Therapy Compact Commission. Chairwoman Pazina and members of the Senate Commerce and Labor Committee, thank you for your consideration of Assembly Bill 248. The PT Compact Commission is an independent governmental entity that currently consists of 38 states and the District of Columbia. Each of the states previously enacted the same legislation that you're considering today. The purpose of the PT Compact is to facilitate the interstate practice of physical therapy with the goal of improving public access to physical therapy services while enhancing public protections. The PT Compact is an alternate pathway for physical therapy providers who meet the eligibility requirements to obtain the privilege to practice in other states within a matter of minutes instead of days, weeks, or months. Instead of a multi-state license model in which an individual licensed in one compact state can legally practice in any other compact state with no notification requirements to the remote state, under the PT Compact, when a licensee wants to work in another active compact state known as the remote state, the individual must purchase a compact privilege for that specific remote state. In addition to the fee charged by the Compact Commission, each state is also authorized to charge an additional state fee for the purchase of a compact privilege. And this compact privilege is the legal authorization to practice in the remote state. Although the compact language authorizes the Commission to levy on and collect an annual assessment from each member state, since the formation of the compact in 2016, it has never levied an annual assessment on the member boards. Instead, the sales of compact privileges have been used to support the operations of the Commission. The PT Compact has many benefits for Nevada, its physical therapy providers, and its citizens, such as the process is faster and more efficient, which allows for improved access and choice of physical therapy providers, especially those in underserved areas. The process also preserves the state-based licensure system while providing an alternate mechanism for a physical therapist or physical therapist assistant to obtain the legal authority to practice in Nevada in a model that requires little cost or staffing for the state licensure board, yet still allows for the collection of fees associated with the purchase of a compact privilege. Importantly, as home to 3 military installations, the compact also supports military families since it greatly improves portability for military spouses by improving the speed and ease in obtaining the ability to practice physical therapy when stationed in Nevada, and for those military families that call Nevada home but may be stationed in other states across the country. The PT Compact is widely supported by physical therapists and physical therapist assistants, including those who live and practice in Nevada. I appreciate the opportunity to be here today and welcome any questions the committee may have. Thank you very much.
Chair Elaine Marzola, for the record, if we can have Mrs. Douglas now present. Thank you.
Good morning, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Kelly May Douglas, KELLIMAY-DOUGLAS, with the Department of Defense. On behalf of the Defense Department and military families stationed in Nevada, I would like to express our support for the policy addressed in AB 248, which would enter the state into the Physical Therapy Licensure Compact. Professional licensure has been an enduring problem for military spouses. Military spouses are a cross-section of the American population, although a greater percentage of them, about 36%, are in a licensed occupation than their civilian counterparts, and they are significantly more mobile. The short duration of military assignments, coupled with lengthy relicensing processes, can discourage military spouses from seeking relicensure in their profession, causing them to quit an occupation or pause their career, or for the service member to leave the military. State policies enacting interstate licensure compacts, such as the PT Compact, relieve one of the many stressors of frequent military moves by enabling military spouses to transfer their licenses more quickly across state lines and obtain employment as soon as they relocate to a new state. These policies facilitate greater career sustainability for military spouses, improving their families' financial security and overall resilience. Notably, interstate licensure compacts benefit not only military spouses, but also apply to all eligible professionals, to include active duty service members, members of the Reserve and Guard, veterans, and civilians. By enacting AB 248, Nevada would have the opportunity to increase its healthcare workforce available to serve the local community while supporting military families. The Department of Defense is very appreciative of Nevada's ongoing commitment and efforts to support members of the military and their families who sacrifice much in service to our country. Thank you.
Paul Klein, KLEIN. Well, you've heard what's in the bill from Chair Marzola. You've heard from the PT Compact folks nationally, and you heard from the Department of Defense. I'll just add just a couple things to perhaps foreshadow any questions that you may have. This compact, what's different from this one from perhaps the other ones that you've heard or will hear, is it's nearly a decade old. It's been around for a little bit, so it's tried and true. It's in 38 states and DC. It's very low cost. The commission fee's $45. It's solely focused on physical therapy. It's not very broad like some of the other compacts. And the Senate, State Senate, you all passed this bill in 2023 unanimously. And then lastly, I'll just say this compact is supported by both the licensees and the licensing board, which I think is unique for this compact. And you'll hear from the Physical Therapy Association, and I represent the Nevada State Board of Physical Therapy, which is fully endorsed and supportive of this bill. Thank you.
Chair Elaine Marzola, for the record, will stand for questions.
All right. Thank you so much. Do we have any questions this morning? It's been a long day. Senator Lang.
Good morning. In this compact, are we just gonna, our licenses, will it just be the West, or is it the whole United States people could travel to, if they move here, they could be a member?
Chair Elaine Marzola, for the record, if I can have Jeff Rosa respond.
Madam Chair, Senator Lang, the way the compact works is the person needs to be licensed in their home state. So if they actually are moving to Nevada, they would be licensed by the Nevada PT board, but that would make them eligible to purchase a compact privilege in any of the other active compact states. Currently, there are 33 states in the District of Columbia are currently active within the PT Compact, and then we have the additional 4 jurisdictions that are still meeting the implementation requirements. But it is a national compact, and anyone that is licensed anywhere in the U.S. that lives in one of the other active compact states would be eligible to purchase a compact privilege for the state of Nevada.
Okay, thank you. And one other question. So does the compact have a board? And if so, will Nevada be on that board?
Madam Chair, Senator Lang, yes, that the Compact Commission has one representative from each of the member jurisdictions. So if Nevada were to enact the legislation, that one of the representatives from the Physical Therapy Board would serve as the delegate to the Physical Therapy Compact Commission.
And Madam Secretary, that was Jeff Rosa for the record. Yep. And we have one more question from Senator Lang.
Sorry. So if we have a place on that board, and I didn't see it in the bill, but maybe I missed it, is it say who that person is? Is it appointed? Is it elected? Just curious.
For the record, Jeff Rosa, Madam Chairwoman, Senator Lang, under the bill, the state's delegate has to be either a member of the Physical Therapy Board or staff of the Physical Therapy Board.
Thank you so much. And I have a question as well. And I was thinking about this when I was reading through parts of the bill. And I was just curious whether in other states in the compact or in DC, if you found that people join the compact and they're maybe more likely to leave their state to go to another state, or if that's just a rarity. And thank you.
For the record, Jeff Rosa, Madam Chair, we typically do not see that obviously if somebody wants to move states, whether that state is in the compact or not, that person is going to move. The compact has really facilitated people that are practicing through telehealth. We have a lot of new PT and PTA grads that like to engage in travel physical therapy, so that they may be 3 months here, 3 months there. They are able to take advantage of the compact. People that are living in border areas of states are able to take advantage of the compact. But we're seeing that it's not just one reason why people want to, that are eligible, take advantage of the PT compact.
Thank you. And one more question from me. And I'm just curious, who was the most recent state to join the compact and when?
Madam Chair, Jeff Rosa for the record. I believe the most recent state to enact the legislation would have been, I want to say, probably a bunch of the New England states. We had Maine, Connecticut, and Vermont pass legislation. There was a state last year, but I can't remember. I'm more focused a lot on the states that have gone live. So this year, Alaska and Vermont both became active compact states. So Vermont, which passed the legislation in 2023, they went as an active state on March 1st. And then Alaska, which actually probably was the last state to pass the bill, Alaska, which passed the bill in the fall of 2024, they just became an active state on May 1st.
Okay, thank you. And I was literally just curious. Do we have any other questions from the committee? Okay. Not seeing any. Thank you so much. We'll have you take a step back from the table, and we thank our presenters who joined us by Zoom as well, Mr. Rosa and Ms. Douglas, and we will invite anyone who'd like to testify in support of Assembly Bill 248 to the table in our physical locations, and then we'll move to the phones.
Thank you, Madam Chair. Members of the committee, Paul Yang with Tom Carter Solutions on behalf of American Physical Therapy Association Nevada chapter. Here today in support, would like to thank Assemblymember Marzullo for bringing the PT Compact AB 248. Knowing it's a deadline week, I'll focus in on two things. It is in 38 other states and continuing to grow, so I think that's important to note, and also expands access to care and more providers in the state, physical therapy providers. So thank you.
Thank you, Chair Pazina and members of the committee. Austin Daly on behalf of the University of Nevada, Reno. For the record, we are in support of AB 248 and the Physical Therapy Licensure Compact. As the presenters noted, it will help enhance access to care for Nevada residents. It helps streamline the licensure process for physical therapists and will help provide more options for veterans and their families to get care across state lines. I also want to add that our School of Public Health is establishing a Doctor of Physical Therapy program that will begin accepting students as early as 2027, helping to address workforce shortages in this area. And our School of Public Health has also submitted written testimony on this bill on some additional data and benefits. But thank you for your time. And thank you for Assemblymember Marzola for bringing the bill forward.
Good morning, Chair Pazina, members of the committee. My name is Tomas Hammond, Tomas-Hammond with Carrera, Nevada, here on behalf of Touro University, Nevada. We are in support of the bill, and we want to thank the sponsor for bringing it, and thank you for your time.
Good morning, Chair Pazina, members of the committee. For the record, my name is Nick Schneider, Director of Government Affairs for the Vegas Chamber. For the sake of brevity, I'll go ahead and echo the comments made by my colleagues. We're in strong support of AB 248 and are very thankful to the sponsor, Assemblymember Marzola. Thank you so much.
Thank you so much. And I don't see anyone in Las Vegas, so we are going to move to the phone lines. Broadcast, do we have anyone on the phone lines in support of Assembly Bill 248?
If you would like to testify in support of AB 248, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 491, you are unmuted. Please continue. Is it possible that you're muted on your end?
Oh, my apologies. Some technical issues. It's been a long morning so far. Can you hear me?
Yes, please proceed.
Okay. Good morning. My name is Casey Melvin, CASEYMELVIN. I am the CEO of Tilton's Therapy and Tilton's Therapy for Tots. We are a multidisciplinary practice servicing across Nevada, and we are in extreme support of the compact that would help us to increase access to care across Nevada for our communities and make it easier to recruit and retain quality talent. Thank you so much for considering passing 248.
Caller with the last 3 digits of 402, you are unmuted. Please continue.
Thank you. Good morning, all. My name is Jennifer Nash. Last name is Nash. I want to thank Assemblywoman Marzola for bringing this bill forward and for all of you here listening. I am a professor at UNLV Physical Therapy Program, as well as the secretary of the Association for Physical Therapy. And I would like to speak in support of this bill. I feel that it will expand access to care and allow many residents in rural areas, as well as even in our cities, to get better care, meaning quicker care due to the wait times that many of my patients have. So thank you for listening to this, and I support this, and thank you.
Caller with the last 3 digits of 936, please press star 6 to unmute. Again, caller with the last 3 digits of 936, please press star 6 to unmute. Chair, it looks like that caller is having difficulty. We'll put through the next caller.
Good morning. Could you guys hear me okay?
Yes, please proceed.
Hi, Chair and Vice Chair and members of the hardworking committee. This is Dora Martinez, and I wholeheartedly support this bill and hope that you all too. We have a family member who is a veteran, and it was difficult for him. He tore his ACL, and he's still waiting on getting some physical therapy. So hopefully you guys can pass this bill. Thank you, and have a great morning. Bye.
Hello, my name is Susan Priestman, Priestman. I'm president of APTA Nevada. This is the association representing PTs and PTAs in Nevada. I wanted to say that the association fully supports the passage of AB 248, and I thank Chair Pezzina and the committee for hearing this bill and hopefully getting it to full session. Thank you kindly.
Chair, you have no more callers in support at this time.
Thank you so much. With that, we will open up Assembly Bill 248 for testimony and opposition, and we'll start in our physical locations. And seeing no one coming forward in those locations, we're going to move back to you broadcast. Do we have anyone on the phone lines in opposition of Assembly Bill 248?
Chair, you have no additional callers at this time.
Well, I'm going to stick with you for a moment since we're already together. Is there anyone in neutral on Assembly Bill 248?
Chair, your public line is open and working, but you have no additional callers at this time.
All right. With that, we will move to our physical locations. Do we have anyone in neutral on Assembly Bill 248? Seeing no one coming forward, would you like to make any? All right. We thank you so much for the presentation today. And again, we also thank your callers that came in over Zoom as well, your presenters, and we will close the hearing on Assembly Bill 248, and we will open the hearing on Assembly Bill 270, which revises provisions relating to professional engineers and land surveyors. We are going to welcome Assembly Member and Minority Leader Hafen to the table, along with Ms. Wilson and anyone who may be in Las Vegas.
Good morning, and thank you, Chair Pezzina, members of the committee. It's wonderful to be with you this morning. For the record, my name is Gregory Hafen II, representing Assembly District 36, and I'm the sponsor of Assembly Bill 270, which revises provisions related to professional engineers and land surveyors, and now architects. With me today, I have my intern, Elijah Weon. I have Ms. Wilson here at the table, and then down in Vegas, I have Ms. Mather and Mr. Faulkner?
Yes,
correct. A little bit of background information. The Nevada State Board of Professional Engineers and Land Surveyors was established in 1919 and served the public interest by regulating and providing leadership to the engineer and surveying professions, individuals, and companies that practice engineering and land surveying in the great state of Nevada. The board regulates over 28,000 professional engineers and land surveyors. Actively practicing professionals total over 16,000, and of those, 3,500 are Nevada residents. In addition, the board oversees the licensure and regulations of these professionals practicing in the 16 engineer principals and land surveyors through its staff and board members. And Chair, with your permission, I'll go through briefly the bill and some of the amendments. I think Ms. Wilson will touch on that as well. So sections 1 and 2 remove the requirement that the applicant must pass the fundamental of engineer examination or receive a waiver of that requirement before taking the principles practices of engineer examination. The measure also revises the years of experience required to waive the fundamental engineer examination from 15 years to 10 years. And that was one of the amendments that was proposed on the Assembly side. Of the original bill had 8 years, and then at I believe the request of several of the Assembly members, we amended the bill to be 10 years. Moving on to sections 3 and 4, it removes the requirement that the applicant must be a graduate of a land surveying curriculum approved by the State Board of Professional Engineers and Land Surveyors, and pass the fundamentals of the land survey examination or receive a waiver. Before taking the principles and practice of land surveyors examination, the measure revises the requirements to waive the fundamentals of the land surveying examiner. Finally, sections 2 and 4 remove the requirements for the content and administration of both the fundamentals of engineering or the land surveying examination and the principles, practices of engineering or land surveying. Instead, it requires the applicant for licensure to pass an applicable examination administered by the National Council of Examiners for Engineer and Surveying or its successor organization, or another equivalent examination that is approved by the board. And I'm going to now turn it over to Ms. Wilson to discuss the amendment that is up on Nellis right now.
Good morning, Chair and committee members. Cassidy Wilson for the record, Cassidy Wilson. Today I am presenting I'm representing the Nevada Board of Professional Engineers and Land Surveyors. Mr. Faulkner is in Las Vegas for any additional questions. I do want to thank Chair Pezzina, Senator Dondero Loop, and staff for this friendly amendment. We appreciate all your hard work that has been put into this. So the amendment for this is for the Board of Architecture and Residential Design. So the board will accept credentials from the laureate of the Pritzker Architecture Prize and authorized to accept the registration in other jurisdictions in lieu of examination for certificate of registration to practice architecture or residential design. Ms. Mather is in Las Vegas for any questions.
We can ask questions at the end if there's any more of the presentation. Or is it complete? Okay.
That is it.
Wonderful.
Thank you,
Well,
Chair.
easy enough. Okay. Do we have any questions from the members? All right. We are a very silent bunch today. This is unusual, and I feel like everyone has gotten off kind of lucky, if we're being honest. We thank you so much for the presentation. We also thank the crew down in Las Vegas being here today to answer questions if we had any, and we thank you all. And with that, we'll have you all step back from the table so that we can take testimony in support of Assembly Bill 270, starting in our physical locations. All right. We don't have anyone here in Carson City. Is there anyone in Las Vegas who'd like to testify in support of Assembly Bill 270? Please begin when you're ready.
Right. Good morning, Madam Chair Pezzina, Vice Chair Daly, members of the committee. My name is Puna Mather. I'm the Executive Director of the Elaine P. Wynn and Family Foundation, PUNAMMATHUR. But you can neither surprise me or hurt my feelings with mispronunciation. I just have a bunch of gratitude. I want to just express big gratitude to Minority Leader Hafen, to Chair Pezzina, to Senator Marin Dondero Loop, to the Board of Architecture, to the Board of Engineers. And if it's useful, I can provide, I don't want to sell past the close, so I could just end it at thank you. But if useful, the impetus for the request for the amendment came from me on behalf of Elaine. Today is the 1-month anniversary of her passing. So this change allows the Las Vegas Museum of Art to lay out a red carpet and to celebrate the arrival of a Pritzker laureate to help design what will be a beautiful Las Vegas Museum of Art. So I don't need to say more than that because I don't need to sell past the close or waste your time because you're already having a long morning. So I'd like to give you back some of the time. And I am enthusiastically in support of the passage of AB 270 and so grateful to all of those that have worked so collaboratively to make it happen.
Thank you so much for being here and for your work with the Elaine Wynn Foundation and for your collaboration with the Assembly Member and Minority Leader. And with that, we are going to move to the phone lines for anyone who'd like to testify in support of AB 270.
If you would like to testify in support of AB 270, please press star 9 now to take your place in the queue. Chair, you have no callers in support at this time.
Thank you so much. While we're with you, broadcast, is there anyone who's on the line in opposition of Assembly Bill 270?
If you would like to testify in opposition of AB 270, please press *9 now to take your place in the queue. Chair, you have no callers in opposition at this time.
Thank you so much. Is there anyone in our physical locations who'd like to testify in opposition of Assembly Bill 270? Seeing no one, we're going to move to neutral. Anyone in neutral on AB 270? Welcome to the table.
Madam Chair, members of the committee, for the record, my name is Jim Wadhams, Wadhams, with the firm of Black & Wadhams, here today representing the Nevada State Board of Architecture, Interior Design, and Residential Design. Would like to thank Poonam Mather in particular and the Elaine Wynn Foundation for their communication on this. And the board simply states its position as neutral. And if this bill is signed by the governor, we'll certainly comply. Thank you.
Thank you so much. And not seeing anyone else to testify in neutral in our physical locations. I can't remember, honestly, if we did this on the phones, but I don't think we did yet. So just to check, broadcast, anyone on the phones in neutral?
If you would like to testify neutral on AB 270, please press *9 now. Chair, you have no callers neutral at this time.
All right. With that, would you like to make any closing statements? Okay. I see no closing statements on Assembly Bill 270, so we are going to close that hearing, and we are making great time this morning and moving into Assembly Bill 334, and we'll welcome Assembly Member Kasama and any co-presenters she may have.
Good morning, Chair Pazina and members of the committee. It is a pleasure to be here this morning. For the record, I am Assemblywoman Heidi Kasama, representing Assembly District 2 in the Summerlin area of Las Vegas. And I would like to turn it over to the ever-popular presenter this morning for comments about our bill, AB 334.
Good morning again, Paul Klein, Klein. This is a dental care access bill. Essentially what we're seeking is to allow for the more immediate Nevada licensure of dental hygienists who are currently practicing in other states. Here's the why. All 17 Nevada counties are designated as dental care health professional shortage areas. 71% of Nevadans are without adequate care. Wait times for teeth cleanings are maxed, sometimes over a year. In certain areas in Nevada. And ultimately, Nevada has two fantastic hygiene programs, CSN and TMCC, but they can only graduate around 30 students annually, not nearly enough to meet the demand. And so here is the demand, right? We have approximately 1,500 licensed hygienists in Nevada. That works out to be one hygienist per 2,200 Nevadans or 45 hygienists per 100,000 Nevadans. The national average is 64. And now when we look at that also, 1,500 licensed hygienists, some of those hygienists became dentists. Some of them work part-time. Some of them left the state. So really when we're looking at 45 hygienists per 100,000 residents, it might be much lower than that. So our need is critical. So essentially what this bill does, it's straightforward. It removes a time restriction barrier, allowing licensed hygienists moving to Nevada the ability to immediately apply for that license, start practicing, and increase Nevada's dental care access.
With your permission, Chair, I'd like to just do some highlights for the bill. So Assembly Bill 334 removes the requirement that dental hygienists seeking licensure by endorsement in Nevada must have practiced for 5 years immediately before applying. Sections 1, 2, and 4 void this regulation, simplifying the process while maintaining oversight by the Board of Dental Examiners. And with that, that is the end of our presentation, and we stand ready for questions.
All right, committee. Do we have any questions this morning? I feel like I've beaten everyone into submission. I don't know how we're so silent because this is not a silent committee. I feel like everyone today has really lucked out. Okay, Vice Chair.
Thank you, Madam Chair. We couldn't let it go by without one question, right? So on the 5-year exemption that we're removing that. So is there any experience requirement if they just brand new and got their license in the other state, and then they could come here and practice even if it was 1-day license? Or is there requirements in the other states? I don't know. So.
Paul Klein. Yes, absolutely. So we're asking no time restriction, but there's certainly time restrictions to get that license in the other states.
So they have to, obviously they have to do the education, the various things, whatever tests and all that kind of stuff. But when they get their license, we assume they're ready to go. So we're just removing that barrier here.
Absolutely.
Okay.
All right. With that, all right, Senator Lang.
Good morning. If someone's coming from another state and we're waiving the 5-year period, and I don't see it in the bill, I looked twice, but maybe I missed it. Do they have to have practice in good standing in their other state?
Paul Klein. Yes, absolutely. So I guess another way to look at it is not only do they have to be licensed in another state, but they have to be eligible to practice in Nevada. And there's a criteria that our Dental Board of Examiners requires as well. It just allows them to apply immediately.
All right. Thank you so much. And with that, we'll have you step back from the table, and we will welcome testimony in support of Assembly Bill 334, starting in our physical locations. And we'll start in Carson City, and then we're going to move down to Las Vegas.
Good morning, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I'm here today on behalf of the Nevada Dental Hygienists Association. We would like to thank the sponsor for hearing, and we would like to thank the chair, first of all, for hearing AB 334. And on behalf of NDHA, we are speaking in support. NDHA recognizes the oral health care and workforce concerns in Nevada. The first 2 sections of the bill enable a one-way path for our state dental hygienists and new graduates to obtain a license by endorsement once they meet all the application criteria of the State Board of Dental Examiners. The NDHA did oppose a section, but thankful for the amendment, and we also wish to thank Assemblywoman Kasama for recognizing the need for more oral health care providers in our state. NDHA is grateful to her for hearing and understanding our concerns, for the amendment, for the current bill. Thank you.
Thank you so much, and we will move to Las Vegas.
Good morning, Chair Pazina and members of the committee. For the record, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 334. The organization agrees with the premise that the board should not adopt regulations that hinder an applicant's ability to be licensed in Nevada if they have practice time in another state. The Chamber believes that boards should foster paths to licensing for healthcare professionals because of the existing dental professional shortage Nevada is facing. We'd like to thank the bill sponsor for bringing the bill forward, and thank you for your consideration.
Thank you so much. And with that, we are going to move to the phone lines. Broadcast, do we have anyone on the phones who'd like to testify in support of Assembly Bill 334?
If you would like to testify in support of AB 334, please press star 9 now to take your place in the queue. Chair, you have no callers in support at this time.
Thank you. While we're with you, do you have any callers in opposition at this time of Assembly Bill 334?
If you would like to testify in opposition of AB 334, please press star 9 now. Chair, you have no callers in opposition at this time.
Thank you so much. Do we have anyone in our physical locations, be it in Carson City or Las Vegas, who'd like to testify in opposition of Assembly Bill 334? Not seeing anyone, we are going to move to neutral. Is there anyone who'd like to testify in neutral on Assembly Bill 334? Not seeing anyone, we're back to you. Broadcast, anyone on the phone line who'd like to testify in opposition of, in neutral of AB 334?
If you would like to testify neutral on AB 334, please press star 9 now. Chair, you have no callers neutral at this time.
All right, Assemblymember Kasama, would you like to come up and make any closing statements? All right, with that, we will close the hearing on Assembly Bill 334. However, we will welcome you back for Assembly Bill 466, which revises certain notice requirements imposed on an insurer who issues a policy of portable electronics insurance.
Good morning again, Chair Pazina and members of the committee. We'd like to present for Assembly Bill 466. For the record, my name is Assemblywoman Heidi Kasama, still from Assembly District 2 in Summerlin, Las Vegas, and I have another wonderful presenter here that I will turn over.
Good morning, Chair Pazina, members of the committee. My name is Jesse Wadhams with the law firm of Black & Wadhams, here today on behalf of Assurian. This legislation before you, functionally, it updates the process by which a cell phone insurance plan or a cell phone insurance provider can give notice to its customers. In 2011, when we passed the original law regarding cell phone insurance, there was no process by which you could do electronic notifications. In 2017, the division updated its laws, and unfortunately, this got sort of left behind, so we have this vestigial law that the cell phone insurance provider must actually send you mail to update its notices. This would simply conform the law to the 2017 law with regard to electronic notices. Basically, it is that straightforward. Happy to answer any questions.
All right, any questions on Assembly Bill 466? I guess it was that straightforward. So we will have you step back from the table, and we thank you so much, and we'll welcome testimony in support of Assembly Bill 466. And we will start in Las Vegas.
Good morning again, Chair Pazina and members of the committee. For the record, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 466. This legislation would remove duplicative administrative rules, which could decrease the cost of compliance for businesses and allow insurers to communicate more effectively with customers. This bill also maintains consumer safeguards. We'd like to thank the committee for its consideration.
Thank you so much. Broadcast, do we have anyone on the phone lines who'd like to testify in support of Assembly Bill 466?
If you would like to testify in support of AB 466, please press star 9 now. Chair, you have no callers in support at this time.
Thank you so much. Do we have anyone in our physical locations who'd like to testify in opposition of Assembly Bill 466? Seeing no one coming forward, broadcast back to you. Anyone on the phone lines who'd like to testify in opposition of Assembly Bill 466?
If you would like to testify in opposition of AB 466, please press star 9 now to take your place in the queue. Chair, you have no callers in opposition at this time.
While we're with you, do you have anyone in neutral on AB 466?
If you would like to testify neutral on AB 466, please press star 9 now. Chair, you have no callers neutral at this time.
All right. Do we have anyone in our physical locations? All right. I knew you were here for a reason. Welcome back, Mr. Plain.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. While I did consider bloviating for the full 2 minutes to make the hearing last longer than it did on the Assembly side, I will be succinct and say the division is all good with this bill. Thank you.
Thank you so much. Always good to see you. Do we have, I don't see anyone else with that. Do you have any closing statements on Assembly Bill 466? All right, we are just powering through this morning. And with that, we are going to open the hearing on Assembly Bill 513, which revises provisions relating to chiropractic physicians and chiropractic assistants. And we will welcome Dr. Yeager in Las Vegas, as well as Mr. Musgrove and further presenters here in Carson City.
Well, thank you, Madam Chair. Dan Musgrove with Strategies 360, today representing the Chiropractic Physicians Board, and it's an honor to be in front of you, Senator Pezzina. I think this is the first time all session. So anyway, AB 513 is a straightforward bill put together by the chiropractic physicians to just update our statute. With us, we have Dr. Yeager, as you previously mentioned. He is our legislative chair. He will run through the bill. To my left is Julie Strandberg. She is our executive director in case there are any technical questions. And again, I think Senator Daley is a member of the Sunset Subcommittee and many others who may have served in the past. The Chiropractic Physicians Board is one of those, we'd like to say, good boards that are always very responsive to the Sunset Subcommittee, follows the mandates of the legislature and the Legislative Commission, and we are one of the oldest boards on record in the state of Nevada. There was an unfounded rumor that when the telegraph operator sent the Constitution back in October of 1864, that 16,000 word document, he asked for a chiropractor after that. But again, it's an unfounded rumor. But I'm going to go to Dr. Yeager and have him run through the bill very quickly. So thank you, Senator.
Thank you, Mr. Musgrove, and thank you, Chair Pezzina and the entire committee. Dr. Yeager, for the record, J-A-E-G-E-R, Legislative Chair for the Chiropractic Physicians Board of Nevada. So this bill, again, as Mr. Musgrove mentioned, is to improve access for Nevada residents. This is language for chiropractic physicians as well as chiropractic assistants. For Assembly Bill 513, Section 1, the chiropractic assistant, or CA, this bill allows chiropractic assistants to apply for a temporary certificate to work under the direct supervision of a licensed chiropractic physician in Nevada. The board's intent is to create a quick temporary licensure for chiropractic assistants to cover staffing shortages for vacations, illnesses, maternity or paternity leave, etc. Presently, the board can issue a time-limited temporary license to a chiropractic physician, but they cannot do so for a CA. Section 2 of chiropractic assistant simply enables Section 1. Section 3 is for a DC or a doctor of chiropractic to serve the indigent or uninsured. This bill removes the membership requirement to the Chiropractic Physicians Board as a board member for one who represents the interest of persons or agencies that regularly provide health care to patients who are indigent, uninsured, or unable to afford health care. It's been difficult to find a member who strictly falls under this definition, and truly most chiropractic physicians at some point will provide services to this type of population. The total makeup of the board would remain unchanged, which is 5 chiropractic physicians and 2 public members. Section 4 is the DC examination, and it's on demand. The on-demand element of this bill will allow examinations that are currently held semi-annually to also occur at other intervals as prescribed by the board. This will allow for the chiropractic physician to be licensed quicker and allow them to take the examination when they're ready, not waiting around for a semi-annual examination period. Section 5 is an attestation for jurisprudence. This bill requires the applicant examination to submit to the board a statement that attests that the applicant has read and understand and will provide provisions of existing law, which include NRS 634, NRS 626, as well as NAS 634, regulations governing chiropractic physicians, and also the regulations that cover Nevada healthcare providers. Section 7 and 10 of this bill eliminate the jurisprudence examination requirement. The reason behind this is that the exam is being offered online, and as it's being offered open book, it's essentially become meaningless and frankly could be subject to cheating. Note, if the committees ask about actually moving on to Section 8, chiropractic assistants, the bill removes the requirement to include at least 12 months of training for the equivalent of chiropractic assistants. The language was aspirational when we created it to develop a high school or a community college or a private entity training program for the chiropractic assistant, but unfortunately that never materialized. Section 10 is attestation of jurisprudence. This requires an applicant that is reinstating his or her license from expired to active to attest that they've read, understood, and will abide by NRS and NAC 634 and NRS 629. This is similar as a new applicant, as I mentioned earlier. Section 11 of this bill is cleanup language to eliminate irrelevant fees and properly define when the board can charge for a fee by the application submitted by a course provider for continuing education, which would include our dry needling. Section 13 of the bill contains more conforming language, as well as requires that a cease and desist order contain a mailing address and email address along with a telephone number. And finally, sections 3, 5, 6, and 12 of this bill provide conforming language at the direction of the CCE, which is the Chiropractic Council on Education, pardon me, to include the Doctor of Chiropractic degree program, broaden its pools of applicants. Basically, what this will do in protecting Nevada residents is this opens up applications and applicants from Europe, Australia, Asia, and Africa. This concludes my testimony, and I can also stand by for any questions.
And Madam Chair, with your indulgence, I just wanted, Dan Musgrove, I wanted to go back over section 11 one more time, starting on page 13. Starting at line 5, this bill does require a 2/3 majority, and I wanted to explain why that we believe that really this is not an additional fee. However, due to the requirements of the LCB, it will meet 2/3 majority, because if you notice, starting on line 5, as I mentioned, through line 12, the provisions for continuing ed has always been there at the same $50, but due to the legislation that was passed in 2019 to allow for dry needling courses, we felt it imperative to go ahead and add that to the statute. So again, it's still the same amount for a continuing education course to be reviewed by the board. It just adds dry needling. And so again, it really isn't an additional fee. It's just a clarification of that fee, but it did, I guess, meet the 2/3. So I just wanted to clarify that in case folks had a concern about voting for a bill like this. So we're open for questions, and again, thank you for your indulgence today on a short, wonderful morning in a Wednesday Commerce and Labor.
Thank you. I will say that when we had 6 bills on the agenda and a work session, I was a bit nervous. So that said, thank you for the presentation, and thank you for clarifying in regards to the 2/3 as well, because I think that was probably a question a few members had. Do we have any further questions? Senator Daley.
Thank you, Madam Chair. Just a quick question. I think just a little explanation. So with the deletions about the open book test and all that in section 7 and then the 12 months, I think he explained a little bit in his presentation in section 8. Are we referring somewhere else to a national test that you guys are using, or is there something in regulation about how the testing is going to be done? So what are the standards if this stuff goes away? I'm assuming you're not eliminating tests, but it's covered somewhere else.
Good morning, Julie Strandberg, for the record, JulieStrandberg. We do have a national test. They have to pass parts 1 through 4 in physiotherapy in order to apply with the board. However, the board has a jurisprudence exam that has become, like Dr. Yeager mentioned, it's offered online, and it's become not a very valid exam. So at this point, we're just allowing chiropractors to sign an attestation that they've read and understand the law to move forward with their licensing.
Thank you so much, Ms. Strandberg. And with that, I don't see any further questions, so we'll have you step back from the table, and we will open up Assembly Bill 513 for testimony in support. We'll start in our physical locations, and afterwards we'll move to the phones. And because we are a quiet morning, I don't see anyone coming forward, so we're going to move to the phone lines. Broadcast, is there anyone on the phones who'd like to testify in support of Assembly Bill 513?
If you would like to testify in support of AB 513, please press star 9 now to take your place in the queue. Chair, you have no callers in support at this time.
All right. Do we have anyone? Then thank you, broadcast. Do we have anyone in opposition of Assembly Bill 513 in our physical locations? Seeing no one coming forward, broadcast back to you. Anyone on the phones in opposition of Assembly Bill 513?
If you would like to testify in opposition of AB 513, please press star 9 now. Chair, you have no callers in opposition at this time.
Thank you so much. Do we have anyone in neutral who happens to be with you right now on Assembly Bill 513 broadcast?
If you would like to testify neutral on Assembly Bill 513, please press star 9 now to take your place in the queue. Chair, you have no callers neutral at this time.
Thank you so much. Do we have anyone in our physical location who'd like to testify neutral on Assembly Bill 513? Not seeing anyone. Would you like to make any closing statements? Okay, I see no closing statements. Dr. Yeager, did you have a closing statement? No. Okay. Thank you so much. We are going to close the hearing on Assembly Bill 513 and do something that we don't frequently do in Commerce and Labor, but we're nearing deadlines, and so timing tends to be of the essence. While we will be meeting back here on Friday for a number of work sessions, we're going to do a couple additional work sessions right now on bills that we heard today, on Assembly Bills 270 and Assembly Bill 513, and we will plan to move those bills quickly. Obviously, there will not be a work session document for these two particular bills, which we just heard, because as amazing and phenomenal and wonderful and exceptional as our staff is, no one could possibly be that quick. So I'm going to hand it over to Mr. Ashton if he has anything he'd like to say to summarize 270. If not, nope. Okay, so as you recall, Assembly Bill 270 revised provisions relating to professional engineers and land surveyors, and we did have the one amendment on that bill that was presented by Ms. Wilson and then Ms. Mather. Do we have any questions from the committee on Assembly Bill 270? Okay, I don't see any questions. With that said, I will accept a motion to amend, do pass Assembly Bill 270.
Motion to amend and do pass.
Thank you so much. We have a motion to amend, do pass from our Vice Chair. Do we have a second? A second from Senator Scheibel. Do we have any further discussion? Not seeing any. I will ask all in favor to please say aye. Aye. Any opposed say nay. Wonderful. That motion carries, and Assembly Bill 270. Will the floor statement, do we have any volunteers? Okay, Senator Lang, we will assign that floor statement to you for Assembly Bill 270, and that will move us to Assembly Bill 513, which we heard literally moments ago, which revises provisions relating to chiropractic physicians and chiropractic assistants. Do we have any discussion? Okay, not seeing any discussion. And Mr. Ashton, were there any amendments on that bill? No, I didn't think so. So no amendments for me to summarize for you right now. I will accept a motion to do pass Assembly Bill 513. Motion. We have a motion from Senator Scheibel. Do we have a second?
Second.
A second from Senator Daly. Do we have any further discussion? Okay, not seeing any. All in favor, please say aye. Aye. Any opposed, say nay. Okay, that motion carries. And do we have any volunteers for the floor statement? Thank you, Senator Scheibel. I noticed a lot of people not making eye contact with me, so thank you. All right, the floor statement will be assigned to Senator Scheibel, and that will close out our second work session of the day. Just with deadlines coming up, it's always good to knock a few things out. So with that, we are going to go to the final item on our agenda, which I think no one thought we would see within about an hour and a half this morning, with 6 bills on the agenda and now multiple work sessions, and we are going to welcome public comment. So if anyone would like to join us and make public comment in our physical locations, we would welcome you up. We ask that you do state and spell your name for the record, and while we ask that you don't discuss any of the bills that were discussed today, we'd love to hear anything you'd have to say that's germane to commerce and labor. And seeing no one in our physical locations broadcast, hello again. Do we have anyone on the phone lines who'd like to make public comment?
Hello, Chair. If you would like to participate in public comment, please press star 9 now. Chair, your public line is open and working, and you have no callers at this time.
All right. With that, we look forward to seeing you back here for a work session on Friday, Wednesday, May 16th, also known as a deadline day. We look forward to it. And with that, we are adjourned.